back at Fort Hood. Just sat down and visited with General McFarland, the commanding officers here. Had a briefing about the national security threats facing us globally and also the challenges facing our soldiers here. Very pleased to be back. Happy to answer any questions.
Sir, we were wondering if you got any updates on the troops deploying to Africa for Ebola, and if you came in with concerns, and were they met?
Well, I certainly have concerns about our soldiers being sent harm's way, particularly when battling a disease like Ebola, which is not an enemy that the Army can shoot bullets. I raised significant concerns that we make sure that any soldiers who are deployed to an area where there's an outbreak have sufficient protections to make sure that we protect the health and safety of the men and women who are serving. And we also have significant protections in place to prevent, God forbid, any soldier from contracting this horrible disease and inadvertently bringing it back to America. And commanding officers here assured me that the Army is putting every precaution in place. And I certainly believe they're trying to do their very best to do that, but those concerns remain significant. I think we need to continue to press to make sure that we do everything possible to protect the health and safety of our soldiers.
The outbreak up in Dallas?
Well, we got the unfortunate news today that the patient in Dallas passed away of Ebola. It is obviously troubling that a passenger on a commercial airline with Ebola was allowed to come to this country, allowed to circulate in the community. That raises significant questions about the effectiveness of our safeguards. And professionals at the CDC are trying very hard to contain this outbreak. We're blessed to have many very capable healthcare professionals in Texas who are on alert for the symptoms of Ebola. But at the same time, I've raised serious questions with the FAA and with the CDC as to what the precautions are that are preventing this disease from coming back again to the United States. And in particular, why we're continuing to allow commercial airlines to fly and bring incoming passengers from nations that have been stricken by this terrible outbreak. There's a 21-day incubation period during which the patients are asymptomatic. They can't be detected. It raises significant concerns. And to date, the administration has not answered those questions. The questions I raised about what precautions are being put in place to protect flight attendants and pilots and flight crews, about what rights of notification commercial airline passengers have if they have traveled on a flight with a passenger who was later discovered to be a victim of Ebola. Those are serious questions, and to date, the administration hasn't answered them. I think our top priority should be protecting the health and safety of Americans, and if that means during the period of a widespread outbreak of Ebola, shutting down commercial air flight from that region, that is an option that should be carefully considered and pursued.
Last question. Today, obviously, federal officials announced that they are implementing new screenings at 5 international airports across the U.S. Are you still pushing for more? Is that enough to protect everyone here in the country?
Well, it's certainly a positive step that they're enhancing screening. But when you have a disease that has a 21-day incubation period, during which screenings are not effective to determine who is suffering from the disease, the screenings do not give great comfort. And sadly, we've seen the consequences of that already here in Texas with one patient who was allowed to come. And it is certainly my hope, and I've been assured, I spoke a week ago with the Secretary of Health and Human Services. It is my hope that CDC is vigorously making sure we know who that patient contacted and keeping each of those individuals under careful supervision to prevent any further spread of this disease. But at the end of the day, if the screenings are not effective in determining who has contracted this terrible virus, then we need to put in place whatever steps are necessary to protect Americans from this horrible outbreak. Our prayers are certainly with the thousands of people who are suffering and dying from this terrible disease, but the first priority of the United States government needs to be protecting American citizens from experiencing a similar outbreak. And it is my hope that that will be the top priority of the federal government, of HHS, of the CDC, of the FAA, and I very much hope President Obama demonstrates strong leadership protecting Americans from this terrible disease. Thank you. God bless you.
Thank you.